Good afternoon. My name is Rochelle Stein Shelley, Chair of the Genesee County Legislature, and I would say to you, welcome to May 15th of 2020, a day that many in our region have been looking forward to. Our region reopened today to phase 1 industries, and this is our first step to gaining back our daily routine and activities. It comes with caution as well. As all chief elected leaders are appointed to the regional control room to monitor health data to ensure that we do not have upticks in hospitalizations and infections, we must maintain our solid behavior patterns of socially distancing, 6 feet apart, hand washing, and face coverings to continue to protect others and ourselves. The control room appointees are responsible to put a further hold on phase reopenings should our health data metrics pop up above allowable limits as set by the governor. Your part to play in this reopening is significant and necessary. Please remember that the stay-at-home order is still in effect for all the rest of the industry not included as essential or part of phase 1. We need to be mindful of our civic responsibility to each other. Phase 1 health metrics will be monitored daily. If the data indicates an unacceptable increase, our reopening is at risk. Your elected leaders have been placed with the responsibility to pause our phase 1 reopening plan. We ask that you help us by continuing to be effective in our social distancing, hand washing, and face coverings. It's truly in your own 2 hands and in your actions. We're your advocates. Do not create a free-for-all that demands this punitive action. I invite you to mark your place in our pandemic history to stop the spread of the coronavirus and to come to full recovery through our care for others before ourselves. Thank you in advance for your full cooperation. There are lives that depend upon it. I would now like to turn this over to Chair Johnson of Orleans County Legislature.
Thank you, Chair Stein. I appreciate you. Both of us are in the regional control room, and we have daily calls together with the rest of the region in the Finger Lakes. And the control room monitors the regional metrics during this reopening process. These regional control rooms monitor hospitalization rate, death rate, number of new hospitalizations, hospital bed capacity, ICU bed capacity, testing, contact tracing within its region, all this during the reopening, and they alert the state if the region's metrics no longer meet the reopening guidelines. And that will adjust the reopening plan for this region accordingly. So it's very important that we go slow, that we go careful, and that all of us enter this first reopening phase of this pandemic carefully. We want to assure the community that it is our goal to do all that we can to help you through this. Your leaders are here to answer your questions. Paul Pettit, your public health director for both counties, has been guiding you through this. And it's imperative that your efforts be implemented in a manner that is safe to you, that is safe to your family, and to the rest of the community during this phase. so that it promotes quality of life, but yet your independence. So even though the state still has imposed mandatory staff and operation restrictions, we recognize the need to be responsive as citizens. So as Chairman Stein said, this is not a free-for-all, but yet we need to be careful because we don't want phase one to be the only phase that we get through. We want to be able to go into phase two, and we can get to phase two within a couple weeks if we do this safe and responsible and we prevent the spread of COVID-19. There are many websites our public health director has led you to, and it's just imperative that we be cooperative, we be charitable, and we be understanding with our neighbors, and that we impose no extra burdens on each other while we go through this, and that we recognize that during the weeks and months to come that there's going to be confusion, that there's going to be many questions, but our public health department is there to help you through this. The county website has a lot to offer you, and so does our economic development departments have many available questions, aids on their websites for you. So we just ask you to be going forward in a safe manner, and like Chairman Stein had said, continue to wear your masks and stay a safe distance from each other. And we wish you well as you open up your main streets. Next is Paul Pettit, our health director. Thank you.
Thank you, Chairman Johnson and Chairman Stein, for your opening comments. I think they articulated very, very well where we're at with things right now, entering into phase one. Again, with the information that they shared, it speaks very eloquently to the need for us to continue to adhere to the guidelines and continue to do our best to practice social distancing. And we are here in phase one. We made it. We officially hit it at midnight, 12:01, and it's an opportunity for us to celebrate a little bit, right? So we should celebrate small victories, but we should do it responsibly and make sure that we're doing it in a socially acceptable way, and stay vigilant. Just because we, again, reached this standpoint does not mean it's a time where we should be letting our guard down to automatically assume we're going to continue to march forward in the path and the trajectory we're on. It's going to continue to take work. It's going to continue to take dedication and focus by all of us within our county and, frankly, within our region, who we're all tied and tethered to. But I do, again, want to take a minute just to thank everybody for helping us get to this point. It's been a long haul. It's been a long 2.5 to 3 months for a lot of folks. A lot of people's jobs, occupations, businesses, our ability, our way of life, what we were used to, and how we function in our daily lives has been interrupted. And no one wanted this. No one asked for it. And unfortunately, we all had to come together and deal with it. And the key here is together. And we've been talking about this week after week on our Friday chats. This is a in it together type of situation for us. We've been really working hard in Genesee and Orleans together over the last couple months and reporting information. But now, as we moved into phase one formally, we do know that we're part of the Finger Lakes region. So it's the 9-county region moving forward that's really going to be able to assess and drive us forward into the next phases and beyond. So again, thank you for everybody doing their part. Wading through and maneuvering through this difficult last couple months. But better days are ahead. We are turning the corner. We are starting to unpause some things. It's just one of those things we need to continue to stay vigilant, continue to stay on point right now, moving forward, so that we can continue that forward momentum. All right, so I'm going to do what I typically do on Fridays. I'm going to run through some quick situational updates and current data for the day and looking back over the week, where we are as of 2 o'clock today. provide some additional thoughts on some of the things, again, that were articulated already by our two chairs. And then obviously we can do some Q&A as time allows and try to get your questions answered. So new cases, as of 2 p.m. today for Genesee County, we've received 4 new cases for COVID-19 for a total of 169 cases in Genesee County. 1 of the positive resides in Leroy, and 3 of the positive cases reside in Batavia. 1 of the individuals is in their 20s, and 3 are in their 30s. 2 of the newly positive individuals were not on quarantine prior to becoming symptomatic. So 1 of them was on quarantine, 2 of those were on quarantine prior. 3 of the previous positive cases have recovered and have been released from mandatory isolation. 1 of the total active positive cases is hospitalized. So again, 1 hospitalized in Genesee County. And also just of note for those keeping track of the data, the Genesee County Health Department received notification that 1 of the patients from the Batavia VA Medical Center has been identified as an Erie County resident. Therefore, the total positive cases will be 1 less and has been adjusted in our data that's reported and on the mapping. So again, we try to get you as accurate a data as we can, but we know it's very fluid and it can change. So as we find these adjustments, we will be making those and notifying folks again, so they hopefully can get the most accurate factual data available to you. Orleans County. So Orleans County has received 8 new positive cases of COVID-19 for a total of 154 positive cases. So again, that's 8 new positive cases for Orleans County being reported today. 1 of the positive cases resides in Yates. 2 of the new positive cases reside in Ridgeway. 1 resides in Shelby. 2 new cases reside in Albion, and 1 of the new cases resides in Murray. So again, spread out throughout the county with our new 8 positives. 1 of the positives resides at the Villages of Orleans Rehabilitation Center. 3 of the individuals are in their 20s, 2 of the individuals are in their 30s, 2 are in their 50s, and 1 of the individuals is in their 80s. None of the newly positive community cases were on quarantine prior to becoming symptomatic. 1 of the previous positive cases have recovered and have been released from isolation, and 13 of the total active cases in Orleans County are hospitalized. Please note that as far as the hospitalizations for both Orleans and Genesee County, they may be from the community or a state-regulated facility. We do not separate them, mainly, again, with HIPAA in mind and trying to protect individual privacy. So we only report the total cumulative number of cases in the hospital, not necessarily if they're community or regulated facility associated. So looking at cumulative to date, again, I'm going to run across this real quick. Genesee County is at 169 positive cases, total of 1,886 negative cases. 15 folks are under mandatory isolation, 49 under mandatory quarantine, 0 under precautionary. We have 4 deaths. Again, that was reported yesterday, another death in Genesee County, so 4 total, and 99 now officially recovered. Orleans County, we sit at 154 positive cases, 1,044 negative cases. We have 20 people in mandatory isolation, 69 in mandatory quarantine, 0 in precautionary, 21 total deaths, and 49 recovered. And just to clarify again, the number of isolations and mandatory quarantine and recovered are community only. That does not cover anybody in regulated facilities. Again, we don't have the tracking ability. They're not the ones that we keep track of as far as the isolation and when they get off isolation. That's all done internally within those regulated facilities. So again, those numbers are for community reports only. All right, and along those lines, just to clarify, because we have been getting a few questions on that around the recoveries. Again, we can't really identify, we don't track those folks when they do go out of recovery, when they are in one of those regulated facilities. Again, following the guidelines that the state has for removal from isolation, it's typically tied to a minimum of a 7-day period, again, based on symptomology at that point. So it is safe to assume that a lot of the folks that have been on mandatory isolation within the regulated facilities that we have reported here have cleared, again, meeting those different time frames. But again, we do not have those numbers available. All right, so again, this was talked about earlier, but we are unpaused. now in phase one, and the goal is to keep us moving forward. We want to continue to reiterate this is a very, very, very fluid situation we find ourselves in. As we've talked throughout the weeks and months now, we've been very clear that a lot of the guidance and a lot of the information we're getting is kind of day by day. We literally find out a lot about what the new requirements are at the governor's press briefings on a daily basis. So usually following with guidance 2 to 3 days later. So it's very challenging for us, and we have a bit of an inside track on some of this information, and it's challenging for us, and I know it's very challenging and frustrating for all of you folks at home who want to have, want to know what's going on, you want to have answers. And again, we are pushing hard, we are seeking, and we are asking, and we are relaying those as we can. So it is fluid, but our goal here is to make sure that we can continue to move from phase 1 to phase 2 to 3 to 4 and beyond. So again, there is reopening guidance. The state has provided a template. We've been putting those links to that information in our guidance document all week that we've been pushing out at our 4 o'clock pressers. So again, we'd encourage folks to make sure they're going to the website. That is the blueprint and the roadmap that we have right now. And they do have a sample safety plan that folks can download. It's a fillable document. And that guide is really comprehensive. It goes through all the different phases and facets of what businesses, organizations, non-for-profits, faith-based communities, essentially anybody that's going to be reopening in any of the phases moving forward needs to work on developing this plan. We've been talking about it for a couple of weeks now. We've been encouraging folks to start thinking about how they're going to be potentially opening their facilities, making sure that they take into account social distancing, cleaning, protecting their employees, protecting the public or consumers that may be coming into their facilities. And this blueprint that has been put together now is a great, or this safety plan template is a great document to use. It covers all the core areas. Again, we did put out a document last week from the health department with guidance that kind of went through a lot of this information. And this document, again, it's not comprehensive fully. It covers a lot of the different information that needs to go into this plan. It has a lot of different links on there that take you to the State Department of Health, that take you to the CDC. Again, any of the reputable websites that I just mentioned, or other state or federal websites that are available, are all good indicators, good places to go to have information that you can plug into your plans. The important thing is that you're taking the time to think through this. The governor has been very clear that everybody has to have a plan. Now, what we're hearing, again, this is fluid, but at the moment, this plan does not need to be submitted. It's not going to be reviewed per se. There is when you go to that website for newyork.gov, there is a process there where you can read through. It goes through the plan, but it also has an affirmation spot where you can attest. You can put your business information in and attest that you've read it, you understood it. You're going to develop a plan. And what our current understanding is, folks need to have this plan available at their location. So again, faith-based community has to have it available. Non-for-profits have to have it available. Any type of business has to have that available, so that if someone does ask, again, if you happen to be regulated by a certain agency, or there's an issue within the facility, there's complaints against the facility, you can say, look, here's my plan. This is what we're doing locally within our business. This is customized towards the logistics of our facility. You can show it. You can prove that you have it done and that it's available, and that's what folks will be looking for. So again, if you're not in phase 1, I would encourage you to continue to work on developing that plan. So when you get to phase 2, 3, or 4, depending on whatever category you may be in for reopening, you're ready to go. So again, hopefully our phase 1 businesses that opened up today do have those plans ready and available if need be. A couple things to note here. Again, we talked about this last week, but the local health department, the local county, we are not, I can't say this enough, the gatekeepers of these next steps. We get a lot of questions. We get a lot of calls. Folks asking us, can we open? Why can't we open? I think, we're maybe in phase 1, but we're listed at phase 3. These are all questions. I mean, we have opinions. We can look at plans and, make some assessments that, yeah, they look pretty good. But bottom line, it doesn't come down to what we have to say with this. This is really a state-driven process. The chairs talked about this control room and kind of the regional oversight. So ultimately, those decisions are not going to be done on a county-by-county basis. So with that being said, I still want to steer people to this fornewyork.gov for any questions that they may have. Again, to get the template, to submit questions. Again, there's a process for, viewing and vetting your certain type of business and where you may fall in the phases. That's the best place I can direct you to. Because again, we're not reviewing, we're not approving, and we want to make sure you're getting to where you need to go so that you can hopefully get your questions answered. No promise on that, but hopefully you can get your questions answered. So again, visit fornewyork.gov, and there's a lot of information there. There's links in this press briefing that I know will be posted up on the different media sites after this, and it's on our website. So again, if you go to local health departments, you'll get all that information. All right, so that was a little bit on businesses. I do want to focus in a little bit on social gatherings right now. So this is kind of a two-phase conversation here, right? We have, the community side, and then we have kind of our personal social side. And, we've talked about this all along, the need to make sure we're really doing our part individually to make sure we're not driving these numbers. We did see some data a couple weeks ago that showed upwards of 60% of positive cases across New York State were from those in the home environment, so to speak. They weren't necessarily identified as essential workers or out in the community or community acquired. They were more circulating, again, in the private or in the homes. And obviously this has a lot to do with the fact most people when they're home with their family or their close family, they're not necessarily practicing social distancing, wearing masks, etc. So it obviously makes sense that the virus could potentially spread fairly quickly within those type of settings. So as we move forward and we talk about social gatherings, we had Mother's Day last weekend. We have Memorial Day coming up. Obviously, summer is all about getting out and enjoying one another's company, having picnics and bonfires and different parties, etc. And these are the events that we really want to make sure folks are really thinking about. Currently, even though we are in pause, it does not mean that the executive order that has our requirement 10 or more as far as gathering sizes, that is still in place. That has not been rescinded or removed, even though we are in pause. So again, we want folks to understand that that is still the cap. As far as social gathering size or with meetings, et cetera, you cannot go above 10 at the moment. And until that changes, we have to live under that guideline. So again, we're asking folks to be considerate, to really think about what they're doing in the, on the private social side of things. Again, there's no monitoring, there's no one watching that. But we do know that if folks, are not adhering to the guidelines, if they're gathering in big groups, having parties, and we start to see clusters and outbreaks because of positive cases out of that, it's going to become problematic for all of us. And we keep reiterating, we're in this together, we're in this together, we're in this together. And literally, if we start to see these cases climb and increase, it's going to impact all of us. The governor's been very clear through this control room that if our data starts to go up, it's going to put us back on pause. None of us want to see that. We need to adhere to the guidelines, do our best to make sure we're social distancing, we're wearing masks, et cetera, so that we can, make sure we continue to move forward in this process. So again, we've talked about this many times here, but New York State on pause, there is a complaint line that's available. There's a phone number, and then also, you can click to make a complaint online. Again, that's available for folks if they feel there are businesses or gatherings that may be outside the guidelines of the orders. That is available for folks to contact and make their complaints or concerns, and then obviously it would be looked at from there. Also, face coverings and masks continues to be a key thing for us as far as unpausing and social distancing and making sure we can continue to move forward. We still have very limited supplies of these locally. We are getting some of these cachet drops in through emergency management, and they're really going to be the key indicator on if and when and how these masks get dispersed to the public. Obviously there's a triage or prioritization of, different types of facility, healthcare, et cetera, moving down, where we want to make sure that masks are available and those are getting to those locations as a priority. But as we move forward and, there is availability potentially for handing these out to the public, we want to make sure that that mechanism is there and that we are making sure that they do get out there. I know in Orleans County, they are utilizing some of the different fire departments to hand some of these out. So again, and I know in Genesee, there's some discussions about how we can make these available to the general public. And these are, again, just the general cloth, washable, reusable face coverings that are required, again, when you can't maintain your 6-foot separation distance. So we'll continue to push out information and share that with different locations, different opportunities to pick those up if you do not have one currently. A couple other things, I mentioned this last week, the ROC COVID-19 health screening tool. That is available. There is a website you can go to. It's embedded here into the documents we're releasing today and has been all this week. Again, this is around encouraging folks to report their symptoms, into the system. It gets aggregated as a region, and it allows us to potentially identify hotspots. And it comes back to us again by zip code. So it would allow us to see if there's something going on in a certain area of a particular county or multi-counties. That, hey, there's something going on, a cluster, maybe we need to go in there and do some targeted testing, et cetera. So this is not a mandate, this is not something you have to do, but it is a new tool regionally that will give us information and allow us to, again, identify hotspots and potentially keep us, again, moving forward on that unpausing path. New York State is continuing to seek contact tracers. So again, there's a link there if folks are interested in applying to be, part of this process and to join into the public health efforts around contact tracing. We'd encourage anybody that may be interested to, look into applying for that. Again, they're looking, last number I knew, for anywhere from 3,000 to 5,000 contact tracers across the state to help with this effort over the next year. So again, that's another opportunity for folks looking for work that may, again, want to be part of this process. All right, so last thing I want to focus in on is swabbing and antibody testing. Again, this continues to be an issue for us locally. We're not really where we want to be. This has not been unchanged for the last couple months. There are a couple locations locally in Genesee County. UMMC obviously has their 10th city set up. Well-Now Urgent Care, we know, is doing swabbing and antibody testing. But beyond that, in Genesee County, it's only private providers that may be offering that. And again, typically you have to be part of their practice as an existing patient to get swabbed through them. But we want folks to call ahead, ask if, they are doing swabbing. If not, they could potentially hit up one of these other sites. Rochester and Buffalo, we do know the state has various sites set up there, these kind of drive-through tent swabbing locations. So again, unfortunately, you got to drive, but there is opportunity within the regions on both sides of us. Orleans County, as we continue to report, we do not necessarily have any community-based swabbing locations currently set up. We continue to push hard for that up the chain. We did, obviously, there was an article in the paper in the Hub this week around Oak Orchard receiving some grant funds for swabbing. So we are partnering with them right now. We're in discussions around how we can potentially provide some community testing. Nothing really further to report at the moment on that, but we are looking at different means and how we can get something set up here locally in Orleans County, again, to offer something locally, because we don't have it right now and we need it to essentially give us some better data and help drive some of the numbers for us, especially as we move into these phases. All right, last couple things. I say this every week on the mental health, behavioral health side. Again, there is help out there as this pandemic and these shutdowns continue to prolong and go forward. People are getting anxious. People are getting potentially depressed and a lot of anxiety. We want to make sure that people are aware there is an option for them. Again, you're not strange, you're not abnormal. If you're feeling this way, there is help. We want people to get that help. So we want to encourage folks to call, again, our mental health departments, other behavioral health agencies within our counties are available. Also, we have the Care and Crisis Helpline that's available 24/7. So please, if you need to talk to someone, if you need assistance, take advantage of it. Don't sit alone and continue to suffer. Make sure you're reaching out, because the help is available. We want to make sure everybody's aware of that. In addition, we've been putting this on here for the last couple of weeks for domestic violence. If anybody finds themselves or is aware of situations that may fall into that category, again, there is help. There is a number, a text line, website that folks can go to, again, to report or to, again, get some help in that area. So with that, I'm going to move towards opening it up to the press. If they have any specific questions, again, I'm not sure who's left on the line. I know some of our folks, Chairman Johnson had to leave for another call. So if there are questions around that, I'll do my best to answer them, or if not, we will be sure to get those answers, get them back to you in whatever means we can. But as you open up and answer questions or ask questions, make sure you state your name and what agency or affiliation you have, and we'll see where it goes. Thanks.
Hey, Paul, it's Howard from the Batavian. Can you hear me?
Okay, Paul, it's Tom Rivers with the Orleans Hub.
How are you?
Good. You know, with the 7 criteria, I wonder if we're vulnerable in some of those criteria in terms of not having much cushion that could trigger us to go back on pause.
Yeah, it's a good question. So, again, if you go on that website there is the indicator tracker, and it lays them out and it gives you the percentages of where we're at. And I think some of them are tight. We don't have a lot of bed capacity as it is in the region per se. Again, this goes backward, but, the Burger Commission and shutting down of different facilities and reducing the bed capacity within the region, has put us in a bit of a precarious spot. I mean, obviously, we've been managing, but when you get into a crisis like this, it puts different strains on our resources. And obviously the governor's directive of having, 30% capacity, you got to have ICU bed capacity. And, we've been okay with it. Obviously we've met the goal, but as elective surgeries are now back within the region, which is a good thing. Obviously we need folks to be taking care of themselves and to have, different healthcare appointments and surgeries taken care of. It is, starting to fill the beds back up. These were beds that were vacant for a couple months when everything was shut down, and now that capacity is getting taken back up by some of these elective surgeries, et cetera. So it is a concern. We need to really monitor it closely, and I think the key, again, of this control room here and the regional focus of our chief electives with Bob Duffy, and again, we have some folks on the health side that are part of that, is to really monitor and track these indicators very, very closely and make tweaks and adjustments as needed. If we're really getting close on a bed capacity issue, we may need to have some discussions around how do we free up additional bed capacity again to make sure we stay under that, that high end of the indicator so we can continue to move forward.
Yeah. In the past, I think you've said we would advance in the phases if everything went well. It realistically would be a month time frame of 2 weeks, and then you observe the data for 2 weeks.
Yep.
And I don't know if that is accurate or if that is what you said, if it's a 2-week interlude, or 2 weeks to advance to the next one, or if it is a month realistically.
So
advance.
Yeah, so that's a great question. I'll give you my best up-to-date answer that I know. So it is what I said. It is what we've known. I have, a lot of documents and emails flying around over the last couple months, and as we move towards unpausing of how it's going to look. It does appear that maybe we've moved from that position a little bit in the last week or two. There still is no clear indication. All we can get for an answer on this is we're going to move from phase to phase based on the data, with a 2-week period in between. So again, there's a little bit of interpretation there, but currently the data is going to drive how we move from the different phases. From what we're hearing now, it sounds like we potentially could be going to phase 2, 2 weeks from today, if again the data continues to be in line with us moving forward. We're going to continually be assessing the numbers on a daily basis, so we're going to have an idea. Again, a lot of them are indicated around a 3-day rolling average. So as we get closer to, I believe it'll be May 29th, it'll give us a better indicator of whether we're still in position to move to phase 2 or not. But again, there's still a little bit of unclarity there. We're trying to be as transparent from what we know as possible, which is why it's very important for potentially those businesses in phase 2 to be ready. If it is May 29th, the day that potentially we can move over to phase 2, we want everybody to have their plan and be ready to go.
Okay, thanks.
Yep.
Hey, Paul, it's Howard from the Batavian. How are you doing?
Good. How are you, Howard?
Good. So I got a few questions here. A reader wanted me to ask about vulnerable workers and what you or any other government official might have to say about vulnerable workers if their businesses are reopening and they don't feel comfortable going back to work. If they quit their jobs, then they're not eligible for unemployment, I don't believe, even under current circumstances. So I'm just wondering what advice for them, or how do they handle it?
Yeah, that's a good question. And, obviously we want folks to feel comfortable. I mean, there's a lot of anxiety out there. We've gotten calls, we received similar concerns, just people just nervous about COVID and not wanting to be going from their homes and back into the community or to their workplace. So it is a challenging thing. So, I mean, you're dealing with a couple issues there. I mean, really it's incumbent upon the businesses and the workplace to make sure they're taking all the precautions that are required. It's very clear that that is the order, that the businesses have to have the plans. They have to ensure their employees are safe and protected. So that is where the onus falls. So I would encourage any employee that may be, coming back to work after being out of the office, so to speak, for a couple months, working from home, whatever it may be, to talk to their employer, to make sure, to ask them, what is your plan? Can I see the plan? How are you ensuring that you're going to be protecting me when I come back to work? The guidelines around, the masks, do you have the masks available? It's required that they do. They have to provide them to their employees. What is the plan around social distancing? How are you going to protect me if I'm working a cash register? If you put up a barrier, plexiglass barrier, et cetera, that, help again create those social distancing positions. So again, ultimately that's going to fall on the employers, but if you as an employee have asked for that information, maybe it's not provided, maybe your business hasn't done that, or they're putting you in a precarious situation that you feel is unsafe, again, you can call and you can reach out to the New York State through those different links that we have provided to make a complaint, to share your concern, Department of Labor, et cetera. Those are all places that are really, in place to help assist if there are businesses that are not taking this seriously, that are not providing the requirements for the employees.
Another question, kind of put a little finer point if possible on something I think you've already kind of addressed. Are we to read into this that with the reopening of phase 1, that there is some anticipation of there will be an increase of cases, and that if there's some window where this small amount of increase is expected, anything over that is where we get into problems? Is that how we're to understand things, or is there still an expectation that we're going to keep in this mostly 1 to 2 cases per day range?
Yeah, great question. I think it's very likely and plausible that we're going to see an increase in cases. There's a couple things that are driving this. As we see increased testing, right? As we see more folks get swabbed, obviously the old adage is if you look for it, if you test for it, you're going to find it. So I think that's going to potentially drive cases. As we unpause and people start coming back together, which is again why I've gone through and reiterated the need to make sure we're still being compliant, especially on the social side of things. There's obviously going to be more interaction. And anytime you have that, there's a higher likelihood you're going to have more exposures, thus more cases. I think the important thing as we move across the phases, a lot of the indicators aren't really directly honing in on a specific number of cases or number of positives. They're really honing on our regional capacity to deal with them. A lot of it's focused on hospitalizations, right? ICU beds, number of available beds. Those type of criteria are really what's, I think, a more important indicator of how we can handle and respond to the most vulnerable populations. Because again, if our elderly, immune compromised, those with underlying health issues need hospital beds, need higher levels of care, that's going to be our issue. The general person in the community, again, we know, again, looking historically, it's still around 80% or so that, have a very mild case of COVID. They have it, they're down for a few days, and then they're, back up and running. So again, as we look at this, it is expected we're going to see an increased number of cases, but we need to do our best to continue to try to keep them low, make sure we're practicing our social distancing, and hopefully not have a spike, right, in severe cases that are going to impact our health system.
And sort of a follow-up to that, how comfortable or confident are you that there's enough testing in place to go with increased activity, and that you have the capacity for contact tracing and everything that goes with managing a scenario where people are having more contact?
Yeah, so the testing kit side is problematic. I just spoke to that a little bit, that it's challenging for us to have the capacity we need. Obviously, if folks are becoming symptomatic after a week or two of unpausing here, we're going to get to the point where they need to be swabbed. So again, find the locations where we can get you to swab and find that out. But regionally is really the key indicator. Again, we unfortunately are lacking in our Genesee and Orleans County area, but fortunately Monroe County, which is the big elephant in the room in the region, has a lot of capacity as far as swabbing. There's no restrictions really. They're swabbing anybody that's going to these drive-through sites. So again, our folks can travel there. They can get swabbed. So access to swabbing regionally is acceptable in the metrics, but not necessarily locally. So again, that's a bit problematic for us, as we've talked about. As far as the contact tracer side of things, we're in very good shape locally within the Genesee and Orleans County Health Department at the current level. Again, if we start to see spikes, we may get in a situation if we have a lot of contact tracing to do, it may stress our internal system a little bit, and that's where we would jump over to the new state contact tracing army that they're developing, right, that I talked a little bit about potentially applying to. What basically the mechanism is, local health departments are going to be doing their own contact tracing, and if we need additional capacity, we're going to notify this system that we need additional help, and then they would deploy virtually the assistance that we need to make sure we're sufficiently numbered to handle any contact tracing we have.
Great, Paul. Thank you. My last anticipated question, and this will ask you to put a little speculation together. I know you watch this very carefully and well informed about this. So with that background, any reason to think that, come summer with heat and humidity, that might help slow things? And then would we expect to see kind of things to come roaring back in the fall and winter?
Yeah, so obviously this is speculation. I know about as much as everybody else that's following this. There is kind of that typical thought when you see it with influenza, things kind of die down over the summer. Warmer weather seems to suppress a lot of viruses and transmission, et cetera. So it's hard to say with this. We talked about this earlier on. If you look at the data, again, in the Southern Hemisphere where it's kind of been inverted with their summer, they still had a lot of cases. They still had a lot of transmission. So it's really hard to say how that's going to play out for us locally here as summer and the warmer weather comes along. Again, that's why we're really stressing the importance of making sure we stick with the guidelines, as we move forward into summer. Because again, we don't want to see those spikes. I mean, if we can keep kind of at a methodical exposure rate, et cetera, we don't stress our systems. I think that's going to put us in a lot better position. Moving into the fall, obviously everything we're looking at, there's a lot of talk about a second wave or some increased activity as you get into fall. This again is a situation that makes it very challenging for us when we start to get into influenza season in October, November, December. As we know, they usually take up a lot of our bed capacity. What we don't want to do is find ourselves in a situation where we were in March when this all hit, right? When there was a lot of influenza activity, COVID activity starting to pick up, and it created a really bad scenario for us. So again, there's a lot to be learned about this virus. There's a lot that we're trying to understand as we move forward in time. We just obviously can only implement and act the way we're able to based on the knowledge that we have. So the best thing we can do is encourage folks to continue to practice the social distancing and do their best to protect others by protecting yourself.
Great, Paul. Thank you. Have a good weekend.
Thanks. Other questions?
Paul, it's Tom Rivers with the Orleans Hub again. I just wanted to ask a testing question. When you put out the testing stats, it says number of tests. I would assume some people have been tested many times. So like in Orleans, I think we're about 1,200 tests right now. Maybe, or that's not how many people have been tested. I guess just to clarify, just to make sure I have that right.
Yeah, so I mean, that's the total number of negative tests. Again, we're not necessarily vetting them out per person per se. That's, as we get the lab results back, they go into the log. So again, 154 positive, 1,044 negative. That's just a raw number of tests.
That's a great question, Tom, and it reminds me of something else. I saw a story yesterday or today about concerns about false negative tests on some of these. Have you seen that? And have you seen any evidence of potentially false negative tests locally?
Yeah, we haven't actually delved into that level of the data locally, Howard. I mean, there's obviously a safe assumption there's some level of false negatives and or false positives with any testing, unfortunately. It's one of those things that, we've had cases and, where even we've reported where someone was tested negative and then they tested positive a day later or vice versa, especially when they get into the health system. Sometimes they swab them more regularly. So again, unfortunately, no test is 100% accurate, and it's something that we need to be aware of. Obviously, big concerns on the antibody testing currently around that, which is something I know they're really trying to hone in on and make sure they can come up with a reliable antibody test. Because again, if we're going to rely on that to provide us data on community exposure and what levels are, we need to really have it as accurate as possible. Any other questions? All right, with that, I'll wrap this up. So, again, thank you for your time. We have made it. Let's celebrate getting to phase 1, but do it socially distancing, respectful, and in line with all the guidelines. And let's stay vigilant. Let's make sure we're doing what we can to adhere to the guidelines and continue to march forward into phase 2. We can do this. We're in this together. And I'd encourage everybody to, go out and go for a walk this weekend. Enjoy the nice weather. It seems like it's finally arrived here in Western New York. So with that, I'll